I'm Emilise, and welcome to the latest episode of Think Like a Vegan, a companion podcast to our book, also entitled Think Like a Vegan. In each episode, I'll explore one topic related to veganism, one that might not be the focus of an everyday conversation. Some we touched on in our book, and here we'll have the chance to take a closer look. I hope these short talks will inspire you and expand the conversation around veganism. Veganism isn't ableist, declares our guest today, Geertrui Cazaux. She writes, by calling veganism ableist, they are erasing the existence of disabled vegans and chronically ill vegans. Yes, we exist. Today, I'm delighted to welcome Geertrui Cazaux, author, blogger, and vegan animal rights and inclusivity activist. Welcome, Trudy. Thanks so much for joining us today.
Thank you.
Before we hear from Trudy, here's a bit of background about her. Trudy focused her PhD work in anthropocentrism and speciesism in contemporary criminology at Ghent University. Her books include Humans and Other Animals, and she was co-editor of a collection of essays from 34 women animal rights activists from the Netherlands and Flanders entitled Een Ander Soort Zuster, which roughly translates to Another Kind of Sister. Because of chronic illness, she's left conventional work. Alongside her activism, Trudy now tends to her animal family and vegetable plot along with her husband. And she has really, really cute donkeys. I highly encourage you to go look at her photos. Trudy has a few blogs covering different aspects of veganism, about which she'll tell us more about at the end of the program. Today, I want to focus on her Crip Humanimal platform, which she created to address the interconnections between ableism and speciesism. And this is such an important topic because ultimately, oppression is oppression. And when it comes to veganism, well, everyone looks for an excuse not to. Today, Trudy will explain why veganism isn't ableist. With that, Trudy, the floor is yours.
Okay, thank you, Emilia, for inviting me to speak on your podcast and giving me this opportunity. I also want to say congratulations with your and Eva's book, Think Like a Vegan. It's a great book to learn about veganism, and it's fantastic that it's reaching so many people. So I want to talk about veganism, but more specifically about a claim that I sometimes hear people make to dismiss or brush off veganism, or use as a reason for not going vegan themselves. And that claim is that veganism is ableist. Now, for those who are not familiar with the term, ableism is the discrimination of disabled persons. So discrimination based on having or lacking certain abilities. Those can be mental or cognitive abilities or physical abilities. So saying that veganism is ableist is saying that veganism is discriminating against disabled persons. The argument that is used to ground this claim is that not everyone can be vegan due to disability or chronic disease. So asking people to go vegan is ableist. This mostly refers to dietary aspects of veganism, plant-based eating, or the use of medication. So the reasoning is that people who need to take medication, as many chronically ill or disabled persons do, cannot be vegan. Because, as you know, vegans avoid products that have been tested on animals or that contain animal-derived products. But many people cannot live without medication. So if veganism imposes, if it is a rule of veganism that you cannot take this life-saving medication, then veganism is ableist. The same reasoning is also used with respect to people who cannot fully adopt a vegan or plant-based diet. For example, due to accessibility issues or medical issues. So in that reasoning, they cannot be vegan. Because veganism also means avoiding animal-based products in your diet. And as these people cannot be fully vegan, the reasoning goes veganism is excluding disabled people or excluding chronically ill people, and it is as such ableist. So whenever veganism is discussed in disabled circles, this claim often, I would even say always, arises with a large section of people agreeing with this and as such rejecting and discrediting veganism. and not only by disabled persons themselves, but also by abled activists for social justice, progressive activists who dismiss veganism because they consider it ableist. So this statement is made by both able-bodied and disabled persons. Okay, now I'm fully acknowledging these arguments, and I am by no means ignoring or dismissing these concerns, because they are indeed very valid concerns. The medical issues, the accessibility of vegan food, the need to take life-saving medication, and I totally get where they are coming from. I am also chronically ill and disabled. I have several autoimmune diseases, and I have been taking medication for 30 years. And yes, I am vegan. So I think the claim that veganism is ableist mostly rests on a misunderstanding of the very definition of veganism, which includes the phrase, as far as is possible and practicable. So the definition, as posted by the Vegan Society in the United Kingdom, goes, veganism is a philosophy and way of living which seeks to exclude, as far as is possible and practicable, all forms of exploitation of and cruelty to animals for food, clothing, or any other purpose. The key element in this definition is the insertion of the phrasing, as far as is possible and practicable. As such, everyone can be vegan. Everyone can try to avoid the exploitation of other animals as far as is possible and practicable. Also disabled persons. Also chronically ill persons. If for some medical reason it is not possible to fully avoid the use of animal so-called products, for example for medication, there are many other aspects in your life where you can still try to avoid it to the best of your abilities. Because veganism is also about much more than medication and diet. Think of the use and exploitation of other animals for entertainment, clothing, cosmetics, and everything from home decoration to hobby material like paint or garment or the saddle of your bike. Vegans try to avoid using animal products for all those things and look for animal-free alternatives as far as is possible and practicable. Now, I know that the insertion of as far as is possible and practicable is a subjective norm, and it leaves room for interpretation. And here is, of course, where the discussion starts. Who will decide what is possible and practicable in one's day-to-day life? Let me take an example, a personal example. When I bought my first wheelchair, I was surprised to find out that the straps underneath the back cushion were made out of animal skin. I asked whether the leather straps in the backing could be replaced with non-animal, so synthetic or faux leather straps. The manufacturer agreed to replace this without any additional costs for me. But the manufacturer may not always provide that, or you may depend on a second-hand wheelchair. And if it requires additional costs, depending on one's social and economic situation, this might be out of reach for some disabled persons. So for me, this was possible and practicable, but it might not be for other disabled persons. Sometimes there might not even be animal-free alternatives for issues like this. Now take the example of medication. And I will expound a little bit more here because it's an issue that also causes much debate also inside the vegan and animal rights community. Yes, medication and also vaccines, to include an issue that has been discussed quite a bit recently, have been tested on other animals. The system requires medication by law to be tested on animals before it can be prescribed to patients. So all medication that is available has, at one point in the research and development phase, been tested on animals. There's no escaping that. So there are no alternatives. There's no medication that has not been tested on animals. I also want to add here that all medical knowledge, the whole body of medical procedures, therapies, medication, and so on, is not only based on unethical experiments and tests on other animals, but is also gathered from unethical experiments on humans. Throughout history, there have been numerous examples of oppressed groups that have been subjected to scientific experiments to test medication or therapies, or even to explore the anatomy of the human body. Think of medical experiments on prisoners, people confined in psychiatric hospitals, prisoners of war, women of color, and so on. I have read horrible accounts of prisoners of war during World War II, for example, about the effects of freezing temperatures on the human body, with POWs being placed outside till literally their limbs froze off. Horrible and shocking accounts. But that body of medical knowledge, how awfully and unethically it has been acquired, and I of course condemn these wholeheartedly, but they have helped to improve the treatment of frostbite. This is also a point that I raise whenever non-vegans try to discredit my veganism or call me a hypocrite for taking medication as a vegan. And then I ask them if they know that the medication they are also taking or the therapies or medical procedures that they have had are based on knowledge from unethical human experiments. We cannot undo this body of knowledge. Even if experiments on animals were to stop now, today, the medication, medical therapies, and procedures that will be used in a century or even later on will still be based on knowledge acquired through unethical tests on humans and other animals. There's no escaping that. The other thing is that not taking medication or even actively boycotting it will not change the system that legally requires them to be tested on other animals. Vaccines or medication do not follow the same supply-demand logic like buying food or cosmetics do. As consumers, we can more or less vote with our dollar or put our money where our mouth is. No, I know a lot needs to be said about capitalism and vegan capitalism and its excesses and its negative impact on humans and other animals. But that then can perhaps be the topic of another podcast. But the point I want to make is this. When it comes down to food, cosmetics, clothes, shoes, we can most often find suitable alternatives that fit our needs, that are accessible, that are affordable. Or we can demand them. And in that way, we can also steer the market and give an incentive to manufacturers to provide vegan alternatives. That is not the case for medication, since all are legally required to be tested on animals, and all medical knowledge is based on animal testing. And even if all vegans would refuse to take medication, that would not lead to legal changes to abolish the use of animals for experiments. If anything, it could lead to fewer people being able to advocate for animal rights, as they might not be able to do so because of their physical or mental condition. And by not taking medication, you not only put your own health at risk, but in the case of vaccines, for example, also the health of others, and especially people from risk groups. So not taking medication will not change the situation of animals. It will not bring an end to animal testing. What we can do as activists for animal rights and social justice is keep advocating for the end of the use of other animals in experiments. We cannot change the past, but hopefully we can end the system in which animal testing is required by law. But as I said, the claim that veganism is ableist doesn't just refer to medication, but also about food, for example. So another aspect that is often raised when making the claim that veganism is ableist is that not everyone can eat a 100% plant-based diet. This is a very delicate discussion, and I fully acknowledge that there are several medical conditions that can make it very hard for some people to eat a balanced, varied, plant-based diet. I'm thinking of, for example, so not limited to gastrointestinal conditions like irritable bowel syndrome, that's EBS, and autoimmune diseases like inflammatory bowel disease, IBD. That's an umbrella term for Crohn's disease and ulcerative colitis. There's also food allergies or food intolerances, which can heavily limit your options, and it can be very difficult for people dealing with eating disorders as well. However, that being said, as far as I can tell from all the medical knowledge that I have gathered, there is no medical condition that absolutely physically requires someone to eat animal products. But because of these conditions that I mentioned, and there are others too, it can be much harder to eat a fully plant-based diet. because they limit the possibilities for someone to eat varied and balanced. This can also have to do with, for example, the lack of access to fresh food, the lack of access to supplements, not having the abilities to prepare food yourself, or maybe even because of lack of dietary knowledge or guidance in making the transition to a varied, balanced, plant-based diet.
We'll stop here for a quick break and listen to this soundscape of hippos, recorded by Derek Solomon at the Chilo Gorge on the Savi River in Zimbabwe at dawn after an early rainstorm. And we're back for the second part of Geertrui Cazaux' briefing on distinguishing the claims veganism is ableist from what veganism actually is.
So here again, the phrasing as far as possible and practicable comes in. And that is, of course, a subjective norm that everyone applies to themselves, against the backdrop of advocating for justice and respect for the rights of other animals. And again, it needs to be stressed that diet is just one aspect of living vegan. So if the dietary aspect is one that you are struggling with, there are so many other ways to live a lifestyle in line with your ethics in support of animal rights. Now, I'm treading very carefully here, and I would really urge other vegans to be very cautious when they are met with a reply from chronically ill or disabled people that they cannot be vegan for health reasons. Because simply brushing it off with the statement, oh, but everyone can eat a plant-based diet, without also knowing the background of that person, the difficulties they face, also their socio-economic situation, will possibly just backfire and shut down the discussion and end them from being open to veganism. Because as a chronically ill person, one is met with so much, maybe good meaning, but nonetheless often frustrating health advice from ableists. I cannot recall the number of times I had ad hoc dietary advice given to me, sometimes also from people who have absolutely zero dietary or medical background, and people who also can't even say the names of the diseases that I am diagnosed with. So please be careful in such discussions. Try to ask questions of what is making it difficult for them to eat a balanced, varied, plant-based diet, and acknowledge that these issues can make it really hard. Try to offer possible solutions or ask them what could help them in transitioning. Don't shame or condemn them. One must also realize that most patients get zero to no dietary guidance from their medical supervisors. And in the rare occasions that they do, the dietary guidelines given by medical staff just reflect the mainstream diet informed by a speciesist ideology that includes animals as food. So many patients are just repeating what their doctors have told them, and unfortunately, many in the medical profession are not aware of the benefits of a plant-based diet and still advise to eat diets full of animal products. I would like to add a personal example here, as one of the autoimmune diseases that I have is Crohn's disease. Now, I was diagnosed more than 30 years ago, and I've been vegan for about 12 to 13 years. On patient platforms for people with IBD, so Crohn's and ulcerative colitis, I'm often met with disbelief and immediate rejection when I simply share a photo of a vegan dish of what I've eaten that day. For example, my lunch dishes always contain a selection of raw vegetables or cooked vegetables, a slice of whole grain bread or whole grain rice, things like almond tofu, hummus, scrambled tofu, maybe some fresh fruit, and so on. I have had my diagnosis of Crohn's questioned by fellow patients because they said it is impossible to eat a dish like that when having Crohn's disease. Many IBD patients have been told for years and years to avoid fiber and raw vegetables. And yes, I agree, in certain periods, in flares or after surgery, it can be advised to eat low fiber, and high fiber can cause additional discomfort. But fiber and vegetables are essential for good gut health, and more scientific research is now advising more or fully plant-based food, also in the treatment of gastrointestinal diseases. And when, as an EBD patient, transitioning to a diet that contains more fiber, it is important to do that in phases. For example, start with blended food or fruits and veg in smoothies, so your gut can get used to it. So there's a lot of misunderstanding to be countered among chronically ill people, as also in the general population, about the benefits of a healthy plant-based diet. So to recap, veganism is taking a stance against injustice to other animals. It is trying to implement that in your day-to-day life by avoiding, as far as possible and practicable, the use of animals in all day-to-day aspects. And this is exactly what all vegans, also disabled vegans and chronically ill vegans, do in their everyday lives. It might not be practicable and possible in all aspects of your life, think of medication, but it surely is possible in a lot of aspects of your life. Vegans, also disabled vegans, avoid the use of animals as far as possible and practicable, given their specific situation. I really think that saying that veganism is ableist is a sort of strawman argument. I acknowledge the issues disabled and chronically ill people can face when trying to implement a vegan lifestyle. But that takes nothing away from the philosophy of veganism and the ethics of animal rights. It takes nothing away from the fact that the way we use and abuse animals for food, clothing, in scientific experiments, in entertainment is wrong. It's unethical. And that we should try to change that. And by adopting a vegan lifestyle, one is taking a stance against the injustice that animals are subjected to. One is trying to move to a system in which animals' rights are taken into consideration. To make an analogy, and I know this comparison might be flawed on several levels, but it's just to make the point. We know that our environment is in a poor state. We know about climate change. There's a whole body of scientific evidence that backs up the need to change the way we live and our impact on the environment. We know that we must take measures to try and improve the environment and halt or minimize climate change. Some of those measures or adaptations have been criticized by disability activists for being ableist and not taking into consideration the needs of disabled people. There are discussions about the use of packaging like single-use plastics, plastic straws, or public transport that is not accessible, or inner cities becoming car-free but no longer accessible for disabled people, and so on. Those are really valid and concerning issues, and they need to be addressed. But that doesn't mean that the need for environmental measures or measures to halt climate change should be thrown overboard or dismissed altogether. We must acknowledge that some measures are not accessible for all and try to make them as accessible as possible. Now, in a similar vein, the fact that some aspects of a vegan lifestyle might not be accessible for all disabled persons is no argument to ditch veganism. That's throwing the baby out with the bathwater. Don't dismiss veganism, but if you are able to, put your efforts in trying to make all aspects of the vegan lifestyle accessible for all, and as accessible as possible for disabled people. Fight against ableism and speciesism. You can do both. They are not mutually exclusive. Advocate for the abolishment of testing on other animals. Now, it especially frustrates me when I see abels use the ableist argument to ditch veganism, as I feel they are using disabled persons as a prop in their rejection of veganism, without truly understanding the core of veganism. And also ignoring the fact that many disabled and chronically ill vegans do exist, and they do try to avoid using animals as far as is possible and practicable. So I, as a disabled person, don't want to be their excuse for them to continue using and abusing animals. I think their rejection of veganism is more often based on common mainstream speciesist ideologies and not understanding the interconnectedness of all oppressions. Sexism, racism, ableism, and so forth, and yes, also speciesism. Now, a thing I would like to add is that unfortunately, although veganism in itself isn't ableist, yes, some vegans or vegan or animal rights organizations or campaigns or projects are ableist. Some examples of ableism in the vegan movement are organizing events that are not accessible, excluding disabled people from activism, or claiming that some people are not good advocates for animals based on appearance. There's also the frequent use of ableist language in the vegan movement, for example, using mental illness diagnosis to refer to people who use or abuse animals. And there's also medication shaming by some vegans. And another aspect which I want to go into some further is the health shaming the parts of the vegan movement. Presenting veganism as a medical cure-all. This is especially coming from so-called health vegans who like to present a plant-based diet as a magical bullet for just about any disease or condition. And if one is not cured, it must be because you're not eating the so-called right kind of plant-based diet. So basically, one is shaming people about their health status and shaming people about their food choices as well. Shaming is not only ineffective to bring about lifestyle changes, but it can also have the adverse effect. And simply, it is wrong. Now look, diet is an important factor for one's health, but there are so many other factors that determine one's health. Not only diet, but also lifestyle, environmental factors. Think of air pollution, water pollution, radiation. Also, genetics play a role, and often there is no one-to-one link between any of these and your health status. Now, I'm certainly not denying that a vegan diet, and certainly a whole foods plant-based diet, is generally beneficial to one's health and can reduce the risk for many chronic conditions and illnesses. Vegans are less likely to have type 2 diabetes, to have hypertension, to develop certain cancers. But a vegan diet is no guarantee for good health. Even vegans can get cancer. Even vegans die. A whole foods plant-based diet greatly reduces the risk for many diseases and conditions, and it can stabilize certain conditions, but it is no magical bullet. So, all of these issues need to be addressed and tackled. And that is also one of the reasons why I launched the platform Crip-Humanimal. I do interviews with disabled and chronically ill vegans in which they talk about their activism, their journey to veganism, and the challenges they faced. And so hopefully they can also be inspiring for other disabled people to transition to veganism. On Crip-Humanimal, I also explore the interconnectedness between ableism and speciesism, animality and disability, by sharing resources, highlighting the stories of disabled vegans and also disabled animals. One of those issues is, for example, how the animalization of disabled people has served and still serves as a tool in their oppression. I also address topics like health shaming and body shaming. So I fully understand the concerns by disabled or chronically ill persons about being met with ableism from the vegan community. But that behavior, those ableist remarks, projects, platforms, should be distinguished from the overall philosophy of veganism, which is in and by itself absolutely not ableist. And although there are certainly problematic sections within the vegan movement, like in any other movement for social justice, I would say, I can also say that a large segment of the movement is really advocating for inclusion of all and for total liberation. But I should also note that dismantling ableism is not only a matter of becoming more diverse and inclusive in our movement. As a social justice movement, we should be working for liberation and justice of all, and ableism must be flat out condemned. And there's still much work to be done there. So those are my thoughts about veganism and ableism. And if anybody wants to get in touch with me, you can reach out via criphumanimal.org, or you can send me a message through Facebook or Instagram. Thanks everyone for listening.
Thank you so much, Trudy. That was an absolute tour de force. And I've been following you now for years, and you always have such sensitivity and thoughtfulness to everything that you say. And I really admire that. You're a remarkable an absolutely remarkable person. So thank you for being so outspoken and bringing clarity to this issue. And it isn't an easy task, especially because it hits you on a personal level. So you've mentioned your website. And do you have any other projects that you want to share, or give the handle for your Instagram as well?
My Instagram is Trudy Bruce Vegan, and I also post a lot on other platforms, and that's brucevegan.com. But that's mainly restaurant reviews and sometimes some thoughts about veganism and animal rights as well. And then for Dutch-speaking people, I post a lot on graswortels, and the literal translation of that is grassroots. So it's like grassroots activism for veganism and animal rights.
Oh, that's fantastic. And I'll make sure everything goes up on the website so people can, all the links will be up. Thank you again, Trudy. Really appreciate it.
Yeah, thank you for having me. Thanks.
In this episode, we continue to tease out the knots of confusion beleaguering veganism. To sum up, I'll read something Eva wrote in our book. Vegans share the common goal of removing violence from our lives and replacing it with fairness towards animals. Understanding these goals means veganism becomes inclusive of everyone, irrespective of age, physical ability, size, or chronic illness. The important thing is we understand these goals because once we do, then we can tackle all the other issues the contemporary world throws at us. And here I want to share something. You might have noticed, although our book is written by me and Eva, I'm presenting this podcast on my own. The reason is Eva lives with a chronic illness herself. Originally, we planned to do this show together, but that's not been possible. So, hearing the perspective of chronically ill vegans is something important per se and for us personally. Eva has been speaking out and writing more about her perspective on life with a chronic illness. That takes courage, and I admire that. I'm proud of her for doing so, and I encourage you to go find her work on her Instagram page, Eat In Workout. Next time, author Benny Malone joins me to share his top 5 favorite fallacies and counter-vegan arguments, and I'll pick my top 3 strategies for talking about veganism with others.
When we go around, we speed things up. When we go around and around and around and around, we speed things up. We speed things up. When we go around.
That's it from me, Emmy Leese. Thank you for listening. I'll post a transcript in due course, along with links and references to the materials we've discussed today on our website, thinklikeavegan.com, and the audio will also be available on Think Like a Vegan YouTube channel. Remember, you can get in touch by email at thinklikeaveganbook@gmail.com, or find Think Like a Vegan on most social media, or find me at emmysgoodeating.com and on Instagram, Facebook, and Twitter. Subscribe to this podcast, share it with others, and leave us a review. And for our book, Think Like a Vegan, it's on bookshop.org or anywhere you buy books, and on your favorite audiobook platform too, or ask your local library to carry it. Production credit goes to Jim Moore of Bloody Vegans Productions. Music provided by Jenny Moore's Mystic Business. The opening tune is Flashbacks, and we close with Tear Things Up.
We go around.